In today's video, we're going to be discussing TMS therapy and bipolar. With me today, I have Dr. Kevin Murphy. Doc, can you tell us a little bit about who you are?
Thanks, Kyle. Yes, I'm an oncologist by training, specializing in pediatric and adult brain tumors with a process called radiosurgery. And the last 10 years, I've spent time working on a personalized approach to transcranial magnetic stimulation.
So, doctor, this is a big one, actually. Tell me about TMS and bipolar.
Well, TMS therapy is transcranial magnetic stimulation. It's a current being applied to the brain. There's a history of higher energies being used to make this happen, and a risk of mania developing in patients that have bipolar with mania. And so one of the contraindications on our clinical trials are patients with a known bipolar history that have manic episodes as part of that.
Okay.
Now, I often tell patients it depends on what happens when you have a manic episode. Is it frequent? Is it severe? Is it just cleaning your house all night?
Okay.
Because it matters. If someone has a sort of a mild mania versus something that's more severe.
Yeah.
As a rule, though, across the board, the most common answer you'll hear from physicians is that it's a contraindication, and it's either it's a soft contraindication where someone's willing to try it, or it's a hard contraindication where someone just won't try it. Again, depends on the person's history.
Okay.
What medication management they're on, their threshold for the experience. In other words, don't touch this if it could possibly get worse.
Right.
Those are patients who say, well, it could get worse, so let's not treat you.
Right.
Someone who says, I've tried everything else and I want this and nothing else has worked.
Okay.
I'll accept some responsibility for if I get a little manic on this. We haven't had experiences of mania in our patients using PR TMS. So in contrast to standard TMS, where high energy is used and one location's given dose, we do a personalized approach in our clinic.
Okay.
PR TMS is the personalized approach, and what that does is reduces the intensity. And the intensity is what we think is the main factor involved in causing overexcitation of regions.
Okay.
So as I turn down the intensity, I'm reducing seizure risk, headache risk, irritability risk from treatment, and probably mania episodes.
Got you.
Because we haven't had any, and we have treated patients with bipolar.
Okay.
But we do give very good counseling to them first. We want medication management to be established.
Right.
We have a psychiatrist in our clinic who will see the patient and monitor the patient. But in most clinical settings, you'll see and read that bipolar is a contraindication.
Right. The most standard TMS facilities wouldn't even treat this,
True,
right?
true. And that's it. Just I think doctors will become more and more accustomed to those patients as time progresses. I'd like to see more of those patients. They can respond exceedingly well to our PR TMS management. So I'm hoping we can get a trial someday that addresses that subset of patients.
That'd be so beneficial.
Yeah, I think so.
Hey guys, if you found that video helpful, do me a favor, click on this one right here. You'll really enjoy it. Did you click it? Click on it. You're going to love it.